about individual single remedies compared to combination remedies, and I have some examples here of both.
You know, a lot of people get really turned on to homeopathy because of the combinations, because they work quite well. And basically what they'll do, let's say for the sleeplessness and restlessness, quietude, okay, that's a really great one. It probably sells very quickly.
Yeah, I know.
Because sleeplessness is a very rampant issue. They take all the popular, most polycrest, and when I say polycrest, it's the most broad spectrum reaching remedies for that issue. So they'll take Coffea cruda, they'll take Nux vomica, Ignatia, and you know, all the remedies that are really important for restless sleep or mental restlessness or frequent waking, and they'll put it into one remedy. Now, that works great for some people, and the difference is that they use usually lower potencies, so it's more for an acute issue. Now, if it's real chronic, oftentimes it's better to go with a single remedy.
And in that case, they would want to seek out a practitioner.
Oftentimes, they'll want to do almost a whole intake because homeopathy is so individualized. For chronic issues, it's fantastic because we take into account not only the physical stuff, but the mental, emotional too, and it paints a picture. And we're trying to match it to that one substance that will match everything. And then we go usually with higher potencies, or, you know, if applicable, of the single remedy.
So that brings me to the question, you know, how does it help chronic conditions? So, for instance, I have an autoimmune disease. I've been treated before. There's people out there with, like you said, ADD, ADHD, allergies even. There's a lot of chronic conditions that people, these clearly are not going to address.
You know, they're, right. You might get temporary relief, very short acting, not long acting. When you have a chronic issue or an autoimmune issue, let's say you have post-traumatic stress disorder or OCD or ADHD, you know, things that are like
depression,
really deep. It's really better to find that one remedy that's going to match everything that's going on for you. Get with a higher potency so that it acts deeper. Okay, so that's the issue of chronicity. The longer you've had it, oftentimes the deeper and the stronger potency is needed so that it lasts. Now, you can get complete healing, so you can get cures. You know, I've like seen incredible things in my practice with Hashimoto's. And, you know, of course you want to do things to support yourself with immune boosting techniques. You want to get off of probably gluten and anti-inflammatory type of situations. But, you know, blood test shows that you can help so much with the homeopathics. As well as with, you know, other like depression or OCD or real chronic other issues too. Insomnia even.
Even a chronic insomnia.
You're
having it night after night.
It's
not just the occasional where quietude is great.
Right.
You're in college, you're studying, you've been up, and all of a sudden you're hyped up and you can't sleep.
It's something out of the blue.
Quietude is awesome.
It's amazing. It's amazing. But let's say you've had it for like 2 years. And, you know, you're starting to feel like you're never ever going to sleep again, and you've just resigned to the fact that you get 3 hours of sleep a night, you know, or very interrupted sleep. That's a good time to maybe seek out a personal, you know, a practitioner who can find that one remedy to match your totality of symptoms.
And when they come to somebody like you for, you know, a chronic condition, what is it that you do when you take their case?
It's called case taking, and basically I don't like to lead the witness. I like to tell them anything that they feel open to tell me, but then I like to go in with more questioning. It is pretty well detailed.
Ziggy Marley. I think he's a star.
It is pretty well detailed. I usually do need about an hour for the appointment because I do go into like almost every aspect of the body physically. I like to know personal history, and that's even medications or past surgeries or traumas. Family history, if that's applicable, and then as well as the mental, emotional, temperament, behavior, likes, dislikes. It kind of all comes into play with finding that right remedy.
I know a lot of people are really surprised by the questions that are asked.
Yes, they probably think they're out of shrink sometimes.
Yeah, you know, like which side would you rather sleep on? Do
well,
you
it's
sweat
really,
at night? Do you not sweat at night?
It's
do you like
really
cold
weird. I know. I've been born and raised with this, so it's not strange to me.
It's not strange to you, and it's not strange to me.
But I can tell you from the flip side, the first time I went to a doctor, just for like I can't remember. I think I broke my collarbone, and it's just like there's no questioning. They just do an exam, and you're kind of in and out in 20 minutes. You get an X-ray, and that's it. So people who have not been exposed to homeopathy definitely get you know, a little taken off guard with all the questions that I do ask. Now, they don't have to answer all the questions if they're uncomfortable by any means, but it is pretty in-depth. And the mental emotional is so important if that's a part of the case.
Right.
You know, it's like one of the most leading
Well, you're
symptoms.
taking a case, so it's really important to know everything.
Everything.
The mental, emotional, and physical, all combined
and
together.
that's the holistic approach.
Right.
I mean, that truly is the holistic approach. And I also work with flower essences. I don't know if you're...
The Bach flower essences.
Exactly. There's other ones besides the Bach that I use, but for mental emotional healing, it's incredible. So I combine that with the homeopathics a lot of times for chronic issues.
That's great. I know with the Flying Nest we do have some flower essences.
Great.
We carry flower essence services. We have a few
love
different
them.
ones. The
They're
yarrow for environmental stress.
Wonderful.
Which I love. We have a few of those products. Okay, another question that I have for you that I'm asked sometimes is on the potency where it says 30C or 9X, or what is it that we're looking for when, let's say, we have a sinus issue, we're starting to sneeze and starting to get congested and maybe a headache.
Yes.
What should we be looking for when we go?
So they typically will show the potencies on the singular remedies. There's a big difference between X and C. Okay, so an X potency is diluted to the 10th. I know that sounds weird, but if you go to the store and you see like a 6X, that means it's been diluted 1 to the 10th 6 times removed from the original mother tincture or substance. Now C's are 1 to the 100th. So they're more dilute. However, in homeopathy, it's such a dichotomy of everything that we are taught from Western medicine.
More isn't better.
Less is more.
Less is more.
Less is more.
Right.
So the more dilute, the stronger it actually is.
Right.
I find, that the X's are great because they usually dissolve really quickly. So they're great for babies. They're great for really acute, like it's just coming on. You're just sneezing, use like an X potency. If it's been going on a little bit longer and it's not so cute anymore, go to the C's. Now, a lot of times, there's 2 things with potency that me, as a homeopath, I look at. One is the person's vitality level. So how much energy do they have? Are they lethargic or are they bouncing off the walls? Secondly, I look at the chronicity. So is it really quick onset or has it been going on for a while? So if it's usually like someone who has a pretty high vitality, they're not laid out or anything like that, and they start sneezing, getting a scratchy throat, that sort of situation, I'll tell them to get a 30C. Okay. Now, if it's been going on even longer than that, like it's not so acute, they've been sneezing or feeling pretty crummy for a week, you still could use a 30C. The lower potencies, like the X's, are really great if you catch it right at the beginning. Right at the beginning, Oftentimes people find they need to do more frequent dosing or that sort of thing of the 30X's if they've had it for a little bit longer, like a day or 2. But it's kind of nice to do the 30 potency range because you can do more frequent dosing if you need to. Yeah. A lot of stores are starting to carry the 30Cs a lot more, I find.
That's pretty much what we carry on the Flying Nest is 30C.
Great.
I don't have any X.
I find this to be a perfect medium range potency. Yeah. So you can do acute or even chronic care with 30C.
With even chronic care.
Yes.
Yeah. All right, that's good to know.
In fact, in the classes that I teach, we usually suggest to start with the 30C strength. And it's usually a good base place to start, for acute or chronic.